there's a medical emergency where someone is trapped, there's not always enough time to wait for an ambulance to get there.
A team with the University of Maryland Medical Center brings immediate care to patients in crisis. WMAR 2 News' Kara Burnett has more.
There was a young man who drove his car off the road and flipped over, and he was trapped between his dashboard and the car.
As part of the Shock Trauma Go team, Dr. Kundi has been dispatched on dozens of calls to provide care during what they call the golden hour, the crucial moments right after an injury.
All of the things that we do to help the patient in the first 10 to 20 minutes of their arrival here, we can do in the field. Whether that's blood transfusion, chest tubes, we have the capability for what we call REBOA, or aortic occlusion.
Dr. Kundi responded to a call Thursday on I-83 where a truck crossed into oncoming traffic.
The driver was pinned between the tree and the rest of his cab, and so extrication was quite a chore.
First responders spent 2.5 hours working to get him free. On the scene, the Trauma Go team was able to do a blood transfusion and give anesthesia to the driver who was awake the entire time.
That gap of time when we're not able to do as much or do anything at all would have really serious consequences on the chances of survival in the short term and in the medium term.
A Shock Trauma Go team has an anesthesiologist, surgeon, and a critical care medicine specialist. For patients quickly losing blood, the team is able to administer 4 full units of whole blood.
That's really far ahead of the state of the art. Whole blood pre-hospital is still something that is years off for most care systems.
He says those key moments of care are life-saving.
The better care that we can provide up front and the more thorough care we can provide up front, the patient will benefit as much as 30, 60 days after the injury.
Kara Burnett, WMAR 2 News.